Movies That Matter series was founded in 2018 to facilitate discussion of important topics through film. The lessons of the Holocaust teach us to have mutual respect for all people. The United Nations Declaration of Human Rights was created in 1948 in response to the horrors of the Holocaust. These film discussions hope to inspire participants to be upstanders for those facing these human rights challenges and abuses. As Elie Wiesel said, the opposite of love is not hate, it is indifference. We encourage people to care about others who are struggling and not to be indifferent. When we care for our fellow human beings, we can move a bit closer to our vision of a world that values mutual respect and is free of hate. I thank our committee members, our partners, and our sponsors of the Steve Brzezina Movies That Matter series. So today's film, Pay or Die, is an award-winning documentary about the dangerously high cost of insulin in America. Our guest speakers today, Tammy and Joe Balavich, and their colleague, Michelle Connor. They know this issue personally. Tammy and Joe's son has type 1 diabetes, and I just learned that Michelle does as well. Tammy and Joe started a nonprofit called Help a Diabetic Child to help other families here in the Naples area get the life-saving insulin and diabetes supplies that they need. Tammy and Joe have met countless families and helped them navigate the healthcare and insurance system, celebrated new medical advances, and grieved with families who have lost children due to the high cost of insulin. The price has come down recently, which is fantastic. And we saw some of the strides that have been made in the film. However, there are still many people who do not have insurance, who do not benefit from this lower price. And there are still many other costs for supplies that can be unaffordable for many. So as we get into this, please feel free to use the chat feature to ask a question of our panelists. Or you can also make a comment about something you learned from the film or something that was interesting, or a question about the film. So I'd like to start out by asking Tammy, tell us a little bit about your son and what motivated you to start your nonprofit organization.
Thank you so much for having us today, Susan and Katie. This is a very important topic. Obviously, Joe, myself, and Michelle feel very passionate about this topic. Like Susan said, our son, Michael, was diagnosed with type 1 diabetes when he was 16 years old, a junior in high school. And at that moment, he was in the hospital. We learned quickly that he's going to have to take insulin injections for the rest of his life just to live. So insulin, we feel, is a right to living. It's not a luxury, it's a necessity. But what mattered to us was not only just keeping him alive, but we learned quickly how costly this disease is. And we have insurance, but the insurance we had still didn't cover a majority of what he needed to get out of the hospital. So our out-of-pocket costs were like in the hundreds. And Joe and I started to talk and said, well, what is he going to do when he's off our insurance plan? Or what do other families do that do not have insurance or do not have decent insurance? After speaking with several local endocrinologists and families, we decided to find Help a Diabetic Child, which is a 501c3 nonprofit. And our aim was to help families that are struggling to get their basic supplies. Well, after months of, purchasing glucose test strips and meters needed to test your glucose level several times daily, we started to feel the impact of the cost of insulin. And that's when we really took on that part of our program to make sure everybody had access to the insulin they needed, because we were hearing stories of families that were skipping doses, not giving their children food because they're afraid their glucose levels were going to rise and they didn't have the insulin to cover it. Sharing insulin vials, sharing syringes needed to inject insulin, sharing pen needles. So this is where Help a Diabetic Child really took off, because we got a lot of attention because there's not a lot of awareness out there about type 1 in general, but about the cost of taking care of diabetes on a daily basis. So Michael is now 30 years old. He's doing well, but it is still a struggle because his insurance plan, even at work, doesn't cover everything he needs. So his out-of-pocket expenses are still pretty high. So it's a challenge, and it does cause for a lot of emotional stress. So that's our story and why we started Help a Diabetic Child.
Thank you. So how big is this issue here in the Naples or Southwest Florida area?
It's a big issue because, first of all, the area is growing, it's exploding, and more children are being diagnosed with type 1 diabetes, even young adults. There's individuals who are in their late teens and early 20s that are being diagnosed, where it seems to be that's where the trend is going. It used to be more 12, 13, 14-year-old, but now it's even a little older. So the trend is going that way, and there are more individuals, children and young adults, being diagnosed with type 1 diabetes. They don't know why. There's several ideas of why. It could be environmental, could be caused by a virus, don't really know, but the need is getting greater because more people can't afford good health insurance plans, so they end up buying like an affordable health insurance plan for themselves. And then when their child is newly diagnosed and they realize their out-of-pocket costs, their co-pays, their deductibles are really high, is when they really find themselves in a jam. And that's when we come in and we'll help for 1 to 3 months to give them that area of time so they could navigate through the process of getting a better health insurance plan, getting on a patient assistance program. Maybe they're looking for a different job, whatever the circumstances may be. But it is, the need is growing.
Tammy mentioned something about the demographic of people, kids and young adults. But we had a situation just happened last week where a lady was diagnosed with type 1 just a few weeks ago, and she is not a young adult or a child. She's probably in her late 60s, maybe even close to early 70. And she was telling, I happened to sit in on a training session with our son when she and our son were being trained on a new insulin pump. And she said that her endocrinologist is finding a trend that older patients are being diagnosed with type 1. As Tammy mentioned, we don't know why it's happening. Is it environmental? Does it caused by a virus as a result of something that you've eaten, you've had to drink or been exposed to? So there's the incidence of insulin-dependent diabetes, maybe not type 1 specifically, but insulin-dependent has grown. And that's growing into a population that is not necessarily young, and they're not necessarily Medicare. They're in an area where they don't have the Medicare coverage, and they're not able to take the advantage of the discounted price of insulin that the manufacturers are providing. And that is provided to individuals only with insurance. If you have no insurance, you're still paying a cash price for a vial of insulin, $300. And a vial of insulin costs about $1.50 to manufacture. And I'm not saying that we're anti-capitalist, but in our country, it's $300. In India, it's $4. In Canada, it's $15. And it kind of goes that way around the world. So the need continues to grow because the cost of the product to keep you alive is growing. And we know, and we've met parents that will actually do anything to come up with the money to buy their kids insulin. We've heard them tell us stories that I wouldn't even want to repeat what they've done. Yeah.
Right. And it's not only insulin. It is.
No, it's
Tammy
not.
was mentioning too, there's other supplies and what are some of the other impacts, not only financially, but time, perhaps? You were just saying that you had to go to a training session to learn how to use a new insulin pump. So
Yeah. So
what else should people know about?
We had an event just a few days ago, and one of the speakers was talking about the impact, the psychological impact on people with diabetes. And the percentage of children who are diagnosed with type 1 diabetes are 50% more likely to suffer depressive disorders because of the type 1, because you've got to manage it every second of every day. You've got to check your blood sugar. You've got to figure out how much carbs you're eating, how many carbs you're eating, how much exercise you're doing. I'm talking to the choir. Michelle is smiling, and she knows exactly what I'm talking about. How much you sleep, how much you exercise. Did you give yourself too much insulin? Did I take enough insulin? How many carbs are in a donut? How many carbs are in a slice of bread? And it's something you've got to maintain each and every minute, every second of every day. Never a day off, never a vacation. Type 1 is always with you.
I could jump in here for a second. I think, Susan, even going to what Joe was saying, it's like when you have type 1 diabetes, insulin is obviously the most important part of having, but with insulin, you need everything else that goes with it. So if you're taking insulin by a pen, so a pen is like an insulin pen that you inject into your body, if you could see me, you need the pen needles that go on top of it. You need the alcohol wipes. Then you need the meter that you put the test strip in to test your glucose levels. There's so many parts of this disease that you need. And even if you're on an insulin pump, you still need these supplies, because to give you an example, our son is wearing a continuous glucose monitor that's connected to his insulin pump that costs thousands of dollars. His insulin pump stopped working a couple of weeks ago. So he needed to go back to the basics with the meter and the test strips. And he had to use the insulin pen, not the pump, to inject himself with insulin. So you need to have all of these supplies with you at all times, or access to them. And going, just even talking about children at school, and Michelle and Joe could tell you that we work very closely with school nurses across the state of Florida. And they know that those children, they know of the children that are in need, because we'll get phone calls or emails or whatever saying, you know, little Joe couldn't come to class today because he needed a glucagon pen. Now, a glucagon pen is an emergency insulin pen. So if a child, his or her glucose levels drop extremely low, they need to take this emergency glucagon pen and give them an injection. And without that, they are not allowed to go to school. One glucagon pen that is mandatory in school is $350 average, right, Michelle?
Yes.
So,
Yeah.
so just like what Joe was saying, and Michelle, we're telling you is that with diabetes, you know, a child and their family need to see an endocrinologist. According to the American Diabetes Association, they recommend at least 3 to 4 times a year. You need to get blood work 3 to 4 times a year. So there's so much work involved with taking care of your diabetes, taking time off from work like our son, to go to an insulin pump training, to go see your endocrinologist, to go for lab work, to endless appointments and endless calls on the phone with insurance companies, like just trying to get covered just life-saving devices and insulin. And maybe Michelle wants to speak a little bit about living with type 1, you know?
Yes, please.
Yeah, so thank you. Yeah, when we talk a little bit about the emotional burden and the diabetes distress, people have called it diabetes burnout in the past. And for someone that is living with type 1 diabetes, they have to make, on average, about 120 more decisions per day than somebody that doesn't have to live with diabetes. So to the point that Joe and Tammy were mentioning, it's a real balancing act. And so one of the things that we're focusing on at HADC is also that emotional support component. Because if people aren't able to afford what they need, there's a lot of distress with that. And even when you have what you need, you're still having to make all those decisions every day. Some days you have good days, some days you have bad days. So we're really encouraging the emotional support piece. And that's something that we're supporting at HADC as well for the clients that we serve.
Tell us more about what you do with the schools.
So what we do with the schools is we rely on the nurses to send us the referrals of the children who are in most need. They know what kids, because children come to school, first thing they need to do is go to the nurse's office and drop off all their supplies, all their insulin, and that's where they do all of their diabetes care. And so we go in front of the school nurses, we do presentations to them and talk about what our services are. And then sometimes we don't send them because we don't actually handle the insulin or the medical supplies. We work with distributors and pharmacies. We'll have packages of supplies delivered directly to the nurses so they could actually have them sent home with the kids or have them there in school. So the kid could go through the whole day without interruption. Because like Michelle said, for no fault of your own, your glucose levels could be riding in the 300s, 400s, and then drop down to the 70s. And it takes you hours to recuperate after that. You're still like not feeling yourself for hours after that. So the school nurses are very important to helping those children keep their glucose levels as stable as possible so that they can stay in their classes, so they could learn their subjects, so they don't have to walk out of the classroom because they're feeling lightheaded or dizzy or ready to pass out or whatever it is because their glucose levels are off out of control. So it's important to have that relationship with those school nurses, because they could contact us and ask us, we need this, we need this, we need this. And then we will actually do whatever we can to make sure they have what they need to take care of those kids at school.
That's
So the kids-
terrific.
Yeah.
Yeah. What do you think about this new law lowering the cost of insulin? I mean, of course, it helps a significant number of people, but do you feel it's been a hindrance at all? Because some people may think, okay, good, that problem solved. We're done with that.
Yeah, just to give you an example, the other night we were we had our annual event and someone said, "Oh, aren't you happy? Insulin's only $35." I'm like, "No, it's not." So it's how it's perceived and how people hear about it. They say, "Oh, it's only $15, it's only $35." It's not. I just, before we got online, just went and I like to check the numbers. Like for five insulin pens, the cost is over $200. So you need actually, if you're taking insulin by a pen, you need a fast-acting insulin and a long-acting insulin. So you need 2 insulin pens. So that's 10 insulin pens. So that's $400 right there. So no, I mean, for people who have insurance and they may qualify for some of these plans, maybe they're getting it at $35. But if you are uninsured and you're still paying cash, you're not getting it that cheap.
Yeah, and if I could
Yes,
just
please.
jump in, Tammy, so for Medicare,
Mhm.
so for our older adults, as part of Medicare, their cost of insulin is indeed limited to that $35, but I think there's been this general assumption for everybody, it's only $35. I know the state of Minnesota passed a law that they actually were successful for their entire population. Anybody that needs insulin, the most they'll pay on a monthly basis is $35. It would be great if we could do that in every state, but that's not the reality in every state. And actually, we have a board member who just spoke at our annual event. He was also president of the American Diabetes Association, and he worked really hard trying to get the price of insulin down, especially in the state of Florida, and unfortunately was not successful in doing that. So to Tammy's point, there's just a lot of variety, and depending on the situation, the price is most likely not going to be $35. In addition to that, you need pens or syringes to administer the insulin. You need to understand what your glucose level is before you administer insulin, because otherwise you don't know how much to administer. And you could get in real trouble if you don't understand what your glucose is. So you need a meter to do that. You need test strips, so on and so forth.
There's a lot to deal with. That's incredible. So you do focus on the emotional side of this. Do you have support groups for families, for individuals with diabetes? How does that work?
So what we've done, we've actually partnered with some organizations who actually will, and that's another whole issue, emotional support. It's really hard finding counseling, affordable mental health. So we've partnered with a couple organizations that'll work with us. And even with endocrinology, access to endocrinology, we're lucky. We live in Southwest Florida. We have some of the best pediatric endocrinologists in the state. But there's a lot of kids across the state of Florida that we're talking about now that don't have access to those pediatric endocrinologists. So they relying, some of them, on their general practitioner to help them deal with their type 1 diabetes, which is not really good. I'm not saying the doctors are great, but they're not specialists in that field. So what we do is we negotiate on our end. We'll be advocates for those patients, and we'll negotiate to help them get a reduced cost to see an endocrinologist or an emotional support. So what we do is we either, we'll cover the cost if need be. We'll help negotiate the price. We'll set up the appointments. We even work with the University of Florida here, who has a great pediatric endocrinology, obviously. They've actually set up a computer in here. So if there's local families or young adults or people who need access to endocrinology or, diabetes education and don't have access to a computer or internet or so on, they could come right here to our advocacy and resource center. We shut the door and they go in there and they can meet with their own diabetes navigator that works for UF. And they go in there, we offer them a space. And then as far as like group supports, we
Virtually, that's not in person, that's a virtual
Yes.
visit, yeah.
Yes, internet. And then we've created some outreach groups, like we just had one, families get together like Chuck E. Cheese, or, we'll do different events throughout the year just to bring these families together so that they know that they're not in this alone.
And if I could just add on one more item to that. So it's not just about the person that's living with type 1 diabetes, but it's really about the family. And I think this most recent event that we had at Chuck E. Cheese, we had a lot of parents come in that couldn't wait to unload emotionally to say, oh my gosh, my child was just diagnosed. Are they going to be able to date people? Are they going to be able to get married? Are they going to have a normal life? Like, they were more upset than the children that
Yeah.
were actually living with the diabetes. So it's a dynamic that that impacts more than just that one person.
Mhm.
And if I could just add on to that, Susan, what Michelle was
Yeah.
saying, you talk about the family. Okay, so you have, mom and dad have 2 or 3 kids, and, like in our case, we had 2, and one of the children is diagnosed with type 1, and then a lot of your resources are now going to that child. So the other kids in the family do get affected by it. And they start to feel some resentment because they feel like, first of all, that child is getting a lot of attention. I can't go to my dance classes because mom and dad don't have the money, whatever it may be. And it seems like, of course, life is more important than dance lessons, but for these children, they don't understand. And so that's very important that, we try to help these families so the kids are not like, their interruption of life isn't really like, give them the opportunity to live a decent quality of life and not, have to have that burden. And Joe and Michelle can tell you, we had a kid, a young girl who was admitted to the hospital because she was not taking her insulin because she heard her mother talking about how expensive it was. And she felt the guilt from that. So by stopping her insulin, wouldn't take it, she ended up in the emergency room in the hospital. So it is there's a lot of psychological effects, I guess you would say, emotional, from this disease.
Sure. And especially, I think, maybe for the younger ones, elementary school, middle school kids who are trying to fit in with everybody else. And they feel, maybe they're the only one who has to go and test their blood sugar several times a day. So it must be nice for them to have a chance to hang out with other kids who are facing similar challenges.
Yeah, it's actually
It's very disruptive, Susan. I don't think our son has slept through the night since he was diagnosed in 2010. And I mean that because your blood sugar goes high, your blood sugar goes low, and you've got to, that's one of the over 100 things that Michelle talked about. So that is his blood glucose monitor over the past 24 hours. And each of those high ups and downs is a point where it needed to be corrected. Now, he fortunately has an insulin pump that makes the correction sometimes, but a child who can't afford an insulin pump has got to either wake up, find orange juice because they're low, or find insulin because they're high. And that causes disruption in the family. If there are two kids and sleeping in the same room and the lights go on because one of the kids has a low blood glucose, then both kids get woken up. And then when it comes time to go to school the next day, the kids are dragging. And that's one of the things that lead to the onset of the emotional distress, because they're not sleeping, they're not studying, they're not doing well in school. Their blood sugar is too high or the blood sugar is too low. It's embarrassing. When our son was diagnosed, there were 15 kids in his class in high school with type 1. And some of them kind of like wore it like a badge of honor. He embraced it and took care of it. But we know that when he went to college, he was in a situation. He was very, very, very distressed about what was going on in his life. So that's a real excellent point, Susan, about the emotional and behavioral health that we're supporting.
Joe talked about, we have a person who volunteers. Her son is a type 1 as well, and he was diagnosed when he was like 5, I think. So she slept on the floor in his bedroom for years, checking him. And then he'd wake up in the middle of the night. Here's other issues. Wake up in the middle of the night, his glucose levels would be really low. So she would be stuffing like sugar into his mouth, like soda or juice, maybe juice or whatever. And then it also becomes an issue with your teeth. And then he'd go to the dentist, and the dentist would be like all upset because your teeth you have cavities. She's like, well, it's hard enough to get him up in the middle of the night to get his glucose levels, and then to make him get up and then go brush his teeth. That's all, So I mean, if you think about the whole thing, it's not just you take a pill every morning. And then Joe was talking about the CGMs, and we're very happy to say that we're working with Abbott Labs, who offers a compassion care program. So it's actually the Freestyle Libre. It's like the size of a little quarter. You stick it on your arm, and you could actually check your glucose levels like all day long like this, so you don't have to prick your fingers as much. And what's good about that is we had a couple kids that we've helped with it. There are 2. And we always think, like, my son was older when he was diagnosed. Dee's was 5, so, but could you imagine chasing a 2-year-old around the house, tackling them to the ground and constantly picking their fingers, trying to get blood to test their glucose levels? Or like trying to inject them with insulin, or trying to get them to eat something because their glucose levels are really low. So we're excited that we're actually able to cover the cost for these continuous glucose monitors for these families and these children.
That's terrific.
Well, the thing is, they say that these items are, like the doctor said, they're like luxury items. They should just not be. They should be it's the standard of care for the American Diabetes Association. So they should be made available without having to worry about costs. But that's why we're here today.
Exactly. So as part of the follow-up to this, we'll have some resources so that people can take action if they choose to. And, if we need to write letters to legislators and things like that, you will let us know, right?
A lot of that going on, Susan. A lot of people are trying to do that. Dr. Des Schatz is one of our board members. I think you know him. He started a program, he initiated a program, like Michelle said, in 2016, when he was president of the ADA, American Diabetes Association. And unfortunately, it has gotten to a point where it appears to be successful, but only if you have the right insurance, only if you're Medicare. Only if you have a private insurance that you're in one of the states that happens to be like Minnesota or Colorado, or I'm not sure which other ones do it, but Florida has nothing like that as of right now. There are 16.5% of the people who are insulin dependent ration their insulin. One of the things we didn't talk about, insulin rationing is a big issue, and that's over 1.3 million people. Close to 1.5 million people ration insulin because they don't have enough, they don't have the insulin to cover their food, or they just don't eat to save the insulin, like Tammy mentioned. So it's an ongoing problem that hasn't gotten any better since we started. There's been more technology improvements, but the cost of insulin has come down somewhat in some places. But for the people that we help, who are the most needy, it hasn't really helped them.
How many people or families are you able to help each year?
Tammy, you got that?
Yeah, that fluctuates a little bit depending on what's going on. I mean, the year of the hurricane, we helped a lot more because obviously you need to keep your insulin refrigerated, and a lot of people lost electricity. They couldn't get to a pharmacy because the pharmacy was flooded or didn't have electricity. There was a huge need for there. So it does fluctuate, but I'd say on average, 450, about 450 children and young adults, we help them.
That's terrific. Yeah.
Thank you.
So there are technology advances and there's medical advances. Do you see those really making a difference? And are they making a difference for a lot of people or only the people who can afford them?
People that can afford them. So the technology that they're coming out with is amazing. And I do have a slide I could probably send you that shows the cost. It's just to get on an insulin pump is thousands of dollars, and that's just to get on it. And unless you meet your copay or deductible, whatever it may be. And then even after that, it's like a monthly cost. They're doing great, but and they do improve quality of life. Like the Libre, if you're wearing a Libre, a CGM, there's a report, and I have it out there that shows like it's 66% less at readmission into hospitals, because you have your glucose levels are more level. And that's one of the things you wonder why they keep it so expensive, because obviously they want to make money, but it's just like, but if this keep kids out of the hospital, keep people from being readmitted to the hospital, it's like, it's just saving money all the way around, it's the burden isn't being passed on to other people.
Right.
So-
Spend your money on prevention instead of
Right, right.
Susan, this
taking
is
care of
this
somebody
is
in the hospital.
That's an insulin pump. And this is the replacement pump that when Michael broke down, the cost of this pump is $4,000, $4,000 without insurance. Yeah. So
Michelle, can I say something? Michelle?
Yeah, and I was just gonna add, the American Diabetes Association published a white paper recently on inequality to access to continuous glucose monitors, which is what they recommend as a standard of care, because as Tammy said, the outcomes are proven. It's a no-brainer. And if you can imagine, I'll try to do an analogy here, but if you can imagine driving a car that didn't have to tell you how much oil was left or to tell you how much gas was left in your car, you'd have to constantly get out of your car and go put like some device in your gas tank to figure out, how much gas do I have left? Am I okay? Can I make it to my next destination or not? That's what it's like managing diabetes for someone who's not using some of these technologies. So, some of it is physicians are super busy. And I think they're relying more and more on diabetes educators and kind of allied health resources to help educate their patients on what their options are. But the American Diabetes Association has a real concern, especially those with lower socioeconomic status. Do they get even access to these? And I will tell you, when I started using a continuous glucose monitor, it changed my life. It's a comfort. If I don't have one on, I'm very worried. It's like driving that car without the gas tank measurement telling me
Mhm.
what I have left.
Wow, yeah. What about medical advances? Joe, I know you've been very tuned in to all of that over the year. Is there hope down the road? Do you see some significant advances coming along?
when you say hope, like hope cure for the disease for type 1, when our son was diagnosed, his doctor told him in 5 years, this will be gone. And then we learned
That was
over
14 years ago.
5 or 6 years that people have been hearing that for the last 45 years. And there really is nothing on the horizon. There are a lot of people working on a cure, people working on different types of in vitro, in vivo, both testing in the laboratory, testing in patients to make some changes. One thing they have the FDA just recently approved. It's a medication that actually can predict and delay the onset of type 1. And it could delay the onset up to 5 years. And the
Wow.
medical community is very thrilled about that. If you have like a child who has a sibling or a cousin or a mom who has type 1, they can check a child if they're likely to become diagnosed with type 1. And this medication can actually predict that. Problem is, the course of the medication costs about $100,000 a year.
Yeah, most
So-
of the cost.
Needless to say, yeah,
Wow.
it's not for anybody for the most part. Medical devices have improved since our son was diagnosed 10 years ago or 12 years ago. And there was not a continuous glucose monitor available at that time. It was always poking your finger 10 times a day. Now, like Michelle said, you've got that gas gauge on your arm or on your belly telling you what your blood sugar is at the time. So those kind of things have been dramatically helpful. The insulins have gotten better. The needles have gotten sharper and less painful. So there have been some advantages, mostly technological, nothing that is addressing a cure.
And you know
Not-
what, Susan, real quick is talk about the technology. It's hard because, and Michelle could probably speak on this better than I can. I could speak watching our son, after wearing it, you have to change your sites where you put these devices on every 3
Yeah.
days. And then you develop scar tissue, and then you develop, some people are allergic to the adhesive. Like there's so many other issues that go, like if you put the pump on and the cannula, the little needle, what I say, it goes in and it hits a blood vessel or something, it starts bleeding, then you have to take it off. So it's hard for some people to wear them. Like, even kids who are in sports and they wear the pump here, like Michelle has, it gets ripped off. So they need another layer of adhesive over it. So you always have to watch out for something. And, if you start developing too much scar tissue, it's not pretty, it just becomes, that's another whole nother issue. And then if you don't control and I'm sure we all know this, your glucose levels, if you don't control them, then you end up at a young age. We've seen young adults with, eye problems, kidney problems, stomach problems, nerve damage, and that's preventable if your glucose levels are controlled. I'm not saying for everybody, everybody's different and we're not medical people, but this is what the American Diabetes teaches, that if you controlled, you could delay these health complications. They don't have to happen early in life.
So what kind of support do you get from the Southwest Florida community or even beyond that? I know you said that you have deals or arrangements with distributors. You do get some products, either low or free from some manufacturers. But you also, obviously, you need cash for some of your operations.
Mhm.
So how has that been for you? I know you were just starting out when we first met, and you've been in business now for what? Let's see.
12 years.
12
This is-
years? Yeah, 12 years.
We were
Started out collecting nickels and dimes in front of Publix.
Oh,
and when we-
Joe, let's back up. I would be standing in front of Publix begging for. Joe's my husband, so that's why. Huh?
when you came home with $100, we thought that was a fantastic thing because we would do it. Fortunately, Susan, we are now receiving some support. We have some strong donors. The Community Foundation, Collier Community Foundation, the Schultz Foundation is still supporting us. We've got
Great.
some other donors in the northern
United
part of
Way.
the state. Yeah, the United Way. Yeah, so that has gotten us to a point where we are not quite at the point where we can say, yes, we'll be able to buy you a $4,000 insulin pump. But we have been able to successfully negotiate with providers, medical providers, the cost of paying for their services. Instead of charging $300 for a visit, they might charge us $150. We've made as Tammy mentioned, made arrangements with the University of Florida through Abbott Laboratories to be part of what's called the Compassionate Care Program, where we receive and redistribute to other physicians continuous glucose monitors. And we provide those at no cost. But it's been pretty well from where we started, Susan, that many years ago. It's kind of like, it hasn't been up and down like someone with diabetes, but it's been a pretty upward trend.
Well, our community is very lucky to have you
Thank
working
you.
on this,
Thank you.
benefiting everyone.
Thank you.
Did you have any other comments about the film in particular? I mean, did those stories sound familiar to you?
Yeah, I mean, one of the stories, obviously, to relating to some of them was Joe and I, maybe a year or two ago, got a call from a family. You know, they had some extra supplies. They wanted to donate insulin. So Joe and I ended up meeting them because what we'll do is we'll take it and we'll distribute it to the correct places. Here, a mom and dad had a son who with type 1 diabetes, went to the pharmacy. It was New Year's Eve, went to the pharmacy to pick up his insulin. Found out that it was a couple days too early before the insurance would cover it, so he would have had to pay cash, which he didn't have the cash for it. So he said, well, I'll come back in 2 or 3 days, try to manage my type 1, you know, not eating or doing whatever, but that doesn't always work. Like Michelle said, your glucose levels could shoot up for any reason. So the parents kept trying to call him, couldn't get in touch, and they drove, I think it was to Miami to see if he was okay, and they found him dead. Well, he tried to, because he could not get his insulin, could not cover the costs, he ended up losing his life. So these are the stories we hear that obviously frighten us because we have a son too, that lives with type 1, but that's an unnecessary loss of life because he couldn't get his insulin. So yes, the stories were very impactful and they do hit home. You know, we do hear stories like that all the time.
Yeah, it's incredible. Well, thank you so much. I don't know if you can see from the chat comments, people find this very helpful, and we would love to get more information. So I will follow up with you so that we can share some more resources with our audience. And this recorded session will be on our YouTube channel, which will then be emailed to all of our supporters, but we'll also make it available to you if you'd like to share it with anyone else. It will be freely available.
Thank you. Is there any of these questions you want us to talk about?
So,
or
I think
Someone asked the question, is
there's
that
a
like
question about it's like a
Dex-
Dexcom.
Yeah,
Yeah, is the
it's the
Dexcom the same?
Dexcom is a different manufacturer. They
a
make
lot more
a
Really?
product that interacts with the insulin pumps. The Freestyle Libre, which is the one that we're a part of, that does not interact yet with the insulin pumps. It avoids having a finger stick. And like I said, you know, for a child, like Tammy said, chasing a kid around, trying to grab their finger and then hurting them to squeeze blood out, it's very difficult. So that's been a godsend. And one of the things Dr. Schatz mentioned too at our dinner a few nights ago is that unequivocally, if you have the education, the supplies, insulin, unequivocally it'll save a life. And you know about him, Susan. He's the interim chair of pediatrics, and he's a pediatric endocrinologist, and he's the former president of the American Diabetes Association. Very passionate about reducing the cost of insulin, forgetting about the economics. He just wants to get it lowered, like so many other of us do.
And I'm just going to follow up with Joe one more thing. Like Joe said, we pay the most for insulin in this country than over 30 or 40 developed countries in the world. We've had people come here from Canada, the Bahamas, or wherever, and when they see the cost of insulin here, they're shocked because you go into Canada, you can walk into from what I heard, I haven't done it, walk into a pharmacy and just say, oh, I need a vial of insulin. Oh, that'll be $20, or wherever. Here, you can't do that, especially if you don't have a prescription. To give you a quick example, I walked into a pharmacy last weekend. Our son, like I told you, his pump wasn't working and he needed to take the injections by insulin pen. So he just needed the insulin tips, the pen needles to inject. And I walked into a major pharmacy and said, can I please buy a box of pen needles? And they would not sell them to me. And I said, why not? And they said, we need proof that he has type 1 diabetes. And because he didn't have his prescription at that particular pharmacy, they had no proof, so they would not sell me. And I said, well, you're telling me that I have to go home and tell my son he cannot take his insulin because you won't sell me the insulin pens. And they said, that's correct. They wouldn't sell them to me. So it's a real problem for people who have type 1 diabetes to get what they need. It should not be that difficult. And I understand this
Absolutely.
out there with, you know, drug use or whatever, but it's impacting these people with, for them not to sell me a box of 25 pen needles, I was really upset. So I just wanted to finish that to show you some of the hurdles that that people need to go to when they live with this disease.
Susan, 2 years ago, just to give you an indication of how important it is to manage diabetes, the Florida Department of Health started a diabetes advisory council. We're part of the Diabetes Advisory Council. We're waiting now for a membership approval, but it meets on a quarterly basis. They're probably going to be changing their meeting to on a monthly basis to discuss everything that we're talking about here today. And unfortunately, it's within a government bureaucracy. It doesn't move as quickly as we would like it to, but they're at least identifying and addressing the issue, at least
Well, that's good.
statewide. Yeah. Mhm.
Yeah, we need some progress because I love that line, Tammy, that it should not be that difficult.
Right,
One of our board members, real quick, our board member said insulin is like oxygen. It should be free,
yeah.
Yes.
right? We need oxygen to live, right?
Yeah.
Susan and Katie and all your guests, thank you so much for having us. We really appreciate it.
Thank you.
Thank you so much.
Mhm.
I look forward to seeing your new offices
Yes.
Good. Anytime, Susan.
and come to the museum.
You're welcome.
Good job.
So our next film will be on February 5th, our film discussion, and the topic is clean food and water. The two films, because one of them is quite short. Gather is one film and the other is Waterborne. And Waterborne is specifically about the water issues here in Southwest Florida with the local water keepers interviewed in that film. Very interesting documentary. Thank you, everyone.
Thank you.
Stay safe and
Thank you.
happy Veterans Day. That's coming up real soon. So take care.
Thank you.
Thank you very much.
Bye-bye.
Bye-bye.